Hi, everybody. I'm excited to talk to you today with Dr. Cyndi and Dr. Gabe from Kinetic Physical Therapy about pelvic floor therapy. This is going to be an amazing talk for a lot of you guys. I'm so glad that some of you are joining in. So I know that I talk to people a lot about physical therapy and particularly pelvic floor physical therapy and how it can change your health. So we're really honored today to have Dr. Cyndi and Dr. Gabe with us. Dr. Cyndi is the Director of Operations for the Chester Springs Kinetic Physical Therapy Clinic. She's got advanced training in pelvic floor therapy, and her specializations include women's health, sports-related injuries, and post-surgical rehab. And Dr. Gabe is the director of the Westchester Clinic of Kinetic Physical Therapy, and his interests include manual therapies, sports, weightlifting, and orthopedics. So join me in welcoming them. I'm going to let them. Hi, guys. Hi! How you guys doing?
Good. We're good, man.
Good.
How are you?
I'm good. Thanks so much for joining us today. Dr. Cyndi, I'm so thrilled to meet you.
Same here. Thanks for having me.
Yeah, so we've got some people tuning in, and I know a lot of people are going to watch later. Particularly, I think I tend to talk a lot about pelvic floor therapy with my female clients, although I know that it can be useful for everyone. And so I just wanted to ask you kind of like my first question is, how is pelvic floor therapy different than physical therapy or what's different about it than maybe a regular physical therapy appointment?
Well, we're still dealing with the musculoskeletal system. We're still dealing with muscles, but it's a little different in the sense that we have the capability of doing some internal work, assessing what muscles are doing, not doing. From the inside, so that's not typical of most physical therapy appointments. But just like other muscles in your body, we can still have the same effect on them with soft tissue work, exercise. So it's a little different, but it still falls in the physical therapy practice.
Perfect. And I think for people who don't know, like, what exactly is the pelvic floor?
Well, I like to describe it as a bowl of muscles. So, if you were kind of looking from the inside down into your pelvis, you would basically see a bowl of muscles. Those muscles are there for various reasons. For elimination, delivering children, and certainly holding everything up in your core to keep it from falling out. I like to describe it to my patients as your foundation. When you're looking at your core, your pelvic floor is basically the floor. It's basically, the bottom, of the room that you're sitting in. And then you have your back, you have your stomach and your sides and your diaphragm. So it's basically makes up the foundation or the floor of your core.
Okay, that makes sense. And to me, I feel like, and a lot of people really get this if they have a problem with their pelvic floor, is you start to realize it's holding up all of your organs against gravity, right? Like your organs are here, it's the only thing between the floor and your organs. So it's really critically important for keeping things where they need to be. Okay, and so you guys get what the pelvic floor is, but what sorts of things can maybe cause problems with the pelvic floor that maybe, people might not think of?
There's a lot of things that can really. I think a lot of times when you hear pelvic floor, you hear people thinking that it's weak, or I had a baby, and now I need to do strengthening for my pelvic.
Right.
Which is often true. That does happen for sure. Like postpartum, patients, we see a lot of people that have had a baby, whether or not they had a prolapse or not. Or C-section or not, and they're having issues, whether it's like low back pain or SI joint dysfunction or just pain in the pelvic floor itself, and they'll end up going to see a doctor, and the doctor might recommend doing PT, and strength is usually an issue. But a lot of times we also see people that have the opposite problem. Someone will come in and they'll have pain there, and it's not that it's not strong, it's that those muscles are very toned up. There's a lot of tone going on, right? Mm-hmm. And then that can itself be painful. Just like you can have like a trigger point in other muscles in your body, you can have that on your pelvic floor as well. And I think think sometimes people don't know that it's like orthopedic in nature, that it's a muscular kind of thing. They think it's something else, or they're just not sure, like it's a stomach thing, or it's something with when they go to the bathroom, and they don't really understand it. And a lot of times, Cyndi and I will see patients that actually are dealing with kind of that hypertonic pain, which is also something that we see people for, but not everyone kind of realizes that.
So maybe your muscles can be too tight, is what you're saying. It's not always that they're too loose.
Oh, yeah.
Okay.
Yeah. Mm-hmm.
Yeah. Well, and so can we talk for a second? Because I think a lot of people that I talk to are like, well, I do Kegels and they didn't help, so I'm fine. Pelvic floor therapy is not going to help me. What's missing in that conversation?
Well, I mean, it's not all about Kegels. Certainly finding out what the problem is to begin with is the first thing. So they may be trying Kegels because they heard, from somebody that you're supposed to do Kegels, because that's the problem. Like Gabe said, they think it's a weakness or it's a problem with the strength of the muscles. First of all, it may be the wrong treatment. They may not need to do Kegels. Maybe Kegels are making the problem worse. That could be one thing. So maybe they're misdiagnosing themselves. The other thing too is they may not actually be doing the Kegel correctly. So they may be trying to do them and thinking they're actually doing the correct exercise, and then they're not getting results. They may not be doing it correctly at all. So that's part of the challenge. When folks are kind of writing off doing any kind of pelvic floor exercise because they may not, have been educated properly, shown the right way to do the exercises, or it may not be the correct exercise at all.
Right. And you can also have people that, maybe they can perform a quick contraction. Maybe they can do a Kegel. Have I been saying Kegel wrong? You say Kegel.
I call them pelvic floor exercises. I guess.
It worked completely.
But you can have like someone that can do a Kegel, right? And they can hold it for like a second or two. They're like, oh, I can do it. But those muscles oftentimes, they're muscles of endurance as well, right? So it's not just like you need to just be able to do it once. Can they hold it and sustain a contraction, right? A lot of times we'll have people with another muscle called your transverse abdominis as well, which works hand in hand with your pelvic floor. They'll be able to turn it on for a second, and then it'll kind of fade away, and they won't be able to maintain that contraction. So can they hold it? Can they maintain that contraction for up to a minute? Can they do quick contractions where they're turning it on and off? Do they have control of those muscles? A lot of the times that's the case, and it's the quality of the contraction we're working on, not just necessarily being able to perform it, right?
Okay, gotcha. So if we had to come up with like a list of symptoms that can occur when you have pelvic floor dysfunction, what would that list be? Because I think it might surprise people. It's not just like pain in your groin. What else can go on?
I mean, you could, I've had folks who have low back pain and, come to find out that, their pelvic floor is really weak. Just to go back to the room analogy, if your pelvic floor is failing for whatever reason, your sides, your diaphragm, you're not breathing properly. Really, the only thing standing left is your back, and you kind of can't really go anywhere. So a lot of times, back pain is indicative of a pelvic floor weakness. So making sure that even when you're talking to your low back patients, you're asking them, do they have symptoms? Do they have any issues? Because they may not even realize that they're related. So certainly something like back pain can be indicative of it. SI joint pain. I've had hip, folks come in with hip pain. And as we're working with them, I've had other PTs ask me to do internal exams on their patients because they can't quite figure out what's going on, and turns out, could be their obturator internus muscle that's giving them some trouble, and that refers pain into the pelvis. So, so there's definitely a host of other diagnoses that, can kind of lead us down a path that, could show us that there is some issues with the pelvic floor that need to be addressed as well.
Yeah, I think low back pain is a huge one. I mean, when it comes to stability, I mean, you have basically three sides, right, or three parts to your core, right? That are providing or creating what we call intra-abdominal pressure. So you have your pelvic floor on the bottom. You have your transverse abdominis, which is like a corset around your waist, and then you have your diaphragm from the top. So, say for example, I have an athlete, right, and they're doing a lift, or they're into CrossFit or weightlifting or whatever. A lot of times, girls will say, or women will say, "Yeah, I like pee a little bit if I'm really pushing hard," and they are like, "Oh man, I was just working so hard." They just think it's like a thing that just happens, right? And that should not happen. You should not be forcing out urine when you're lifting that hard, right? But that's a pelvic floor issue, right? And that's because they're creating, to do that max lift, they're creating so much intra-abdominal pressure to maintain that stable spine. And then the weakest part of that for them is their pelvic floor. And that's where they're seeing the symptoms, right? That's where you're having that, stress incontinence, we call it.
So guys, it's not normal to pee when you laugh or jump. Is that what you're saying?
Right. Yeah, that is totally
okay.
It's very common, but it's not normal. So a lot of times folks write it off as I've had a baby, I've had two babies, I've had my grandmother had this problem. That's what we try to drive home. It's not okay. There's treatment for it.
Right.
Well, and so, I think a lot of people think, all right, I pee when I laugh. I'm just going to deal with this because I don't feel like going through months and months of, therapy. But I think it seems like there's some pretty quick stuff that you guys can do an assessment, and it's not going to, talk us through a typical course of therapy. If somebody, let's just say it's stress incontinence after a baby.
Yeah.
What can somebody expect if they come see you?
The good thing is, certainly depending on the complexity of the problem, they don't have to be in the therapy clinic 2 and 3 times a week to address this. I tell my patients a lot of this is homework. The majority of it's homework. I'm going to give you the tools and teach you how to, breathe correctly, how to engage your pelvic floor, or relax your pelvic floor. Whatever the case is, there may be some supporting exercises that we can build upon. But ultimately, they're going to need to, this is a daily thing. So I may have them doing something, several times a day. It may be activity modifications to minimize some stress incontinence. If it's overactive bladder issues and things, it's a daily process. This isn't just we exercise and then we move on the rest of the day. So the good news is, that could maybe only be 1 or 2 times a week. And I like to communicate with my patients outside. So if they have questions, maybe it's just a matter of a simple fix. But it's a lot of homework. So it doesn't have to be a whole drawn out process. But if they do the homework and put in the work, then they'll see results, fairly quickly.
Right. And it's not like you need a lot of equipment to do pelvic floor exercises, right? We're not hopping on machines. You can be in line at a grocery store and doing contractions. I'm doing a Kegel right now.
I know.
No, right? You can do it anywhere.
With an Instagram Live.
And a lot of times that's what I end up telling people. It's you have to be doing these things multiple times throughout the day. And it's not like you even really need to set aside time. You can be doing it in different positions. And we encourage that because you have to be able to contract those muscles and, maintain those contractions when you're standing, when you're sitting, when you're walking, when you're squatting, things you do in daily life. So you can just work it into your daily routine, especially if it's strength issue.
So I heard you say something, Dr. Cyndi, a minute ago about talking with your patients about breathing. So how is breathing related to pelvic floor issues?
So just kind of touching on, what Gabe was talking about, with our diaphragm being sort of the roof of, a floor. If you were to look at how you breathe, we're asking people to, take deep breaths in. You're taking a deep breath in before you lift a weight or exert, get out of a chair, get out of your car. A lot of times, we're taking these deep breaths in, but we're holding our breath. And a lot of times what happens is it's your breathing mechanics that's causing some of the stress incontinence issues. So if we're looking at our diaphragm, the way it sits under our lungs, and our pelvic floor, if we're resting, we're just kind of breathing normally, no air in our lungs, little air in our lungs, our diaphragm is up, our pelvic floor is up as well. we take a deep breath in, our diaphragm has to drop to allow room for the lungs to inflate, which means they've got to push everything else in your tummy down to make room for that. Well, what happens is your pelvic floor will drop as well, just to allow that room. Now, if we get to this point and hold our breath and exert, so lift that weight, get out of the car, whatever activity it is that we're, that intra-abdominal pressure is so great at that point. If our pelvic floor is weak, you can see how, with our pelvic floor dropping and then extra pressure is going to create some incontinence if we don't have the ability to hold that close. So, just giving patients an awareness of how they breathe can really make a difference. Making sure that with our higher level athletes, if they're gonna squat, making sure they know when to breathe can make a huge difference. And a lot of times these symptoms can go away relatively quickly just by the awareness. I have many gals, getting in and out of the car, picking up little ones. They tend to hold their breath. So sometimes just something as simple as that breathing awareness can help with symptoms.
Beautiful. It sounds about like mindfulness.
Absolutely. That's why this is all homework. That's why, we can work on it here, but you got to continue this throughout your day because, those opportunities show up all the time.
Yeah. Okay. So they come in and like you guys kind of help them reflect to them what's going on with their own anatomy, right? So how they're breathing dysfunctionally, what muscles may be too tight, what muscles may not be strengthened enough. Okay. And so let's talk through, we've talked a lot about incontinence and then we've talked somewhat about women's health, but Dr. Gabe, I wanted to pick your brain. So how does pelvic floor health issues, like does that show up differently in men sometimes? Men?
I wouldn't say it shows up differently. A lot of times I would say men are more hesitant to seek help for it, right? It's not that it's just like embarrassing, but like we said earlier, they just don't realize that it's connected to like an orthopedic thing, right? A lot of times we'll just have people that are just holding a lot of tension there, and they're like, man, after work, when I'm working a long day and it's stressful, it just like hurts, like it doesn't feel good, right? And so I would say like giving people education to start with, just to be aware that it's an issue that can be corrected, right, is part of the battle. In terms of like the male symptoms, I mean, you can have it as you're getting older with prostate issues. We see a lot of people after they had surgery for prostate issues, prostate cancer, and things like that. You can have side effects from that can result in incontinent type of issues. And what a good therapist should also be doing is talking to you about and finding out about those bowel and bladder movements as well. Because a lot of times it's connected to people's bowel and bladder. So that comes back to you too, like patients that you have who are, you have to look at their diet, and that's not something we do. But like in general, if they're having pain every time they go to the bathroom, that's a bowel and bladder, issue, right? That's connected to the pelvic floor, right? It's all part of it. So trying to connect those dots and then let the right practitioners know. Have you found that when you get people who are coming in with like issues like that, is like their diet something that can be changed? Do you have any like recommendations for things like that?
Yeah, absolutely. I mean, a lot of people, so are you talking about like if people are constipated?
Yes.
Yeah. So guys, if you're constipated and you're straining, this is kind of what we're talking about. All that pressure in your abdomen as you're trying to push out a bowel movement can cause problems over time. And then you end up seeing a great physical therapist who will help you. But with those people who are constipated, it's usually pretty simple. Usually they're not drinking enough fluid. They're not eating enough fiber, or maybe they're low in minerals. So sometimes something as simple as like adding some magnesium, whether it's through a food source or a supplement, will help them clear that up. But I will say, like, if you've been constipated for a long time, guys, and you have been straining for a long time, you probably have some pelvic floor dysfunction that you're going to need to have fixed, even if we fix the constipation, because those muscles have muscle memory, right? I mean, like, you guys could speak to this too. It's not just like you fix the problem and then your muscles stop being too tense on one side and too loose on another. Sometimes you need to be really intentional about how you fix it. But yeah, I love talking to people about poop. It's my favorite thing. It's very weird, but we talk about poop all the time, and it's one of the easiest things to fix. And so many Americans aren't having normal bowel movements. And it's, it's going to mess with your anatomy. and your overall health the longer that occurs. So yeah, totally. Easy peasy. We can fix that. Fix that right up. Yeah. Okay.
Too. I mean, for us, like we're like, tell me about. It's always a weird question too when you get to the exam. At least for us, because people it kind of catches them off guard. Like they think they're coming for PT, which they are, and I'm like, tell me about how your poops go. Like what's going on with
We're
that?
getting in there, guys. You really
like, it's fine, dude.
really get to know each other on a personal level.
Exactly.